So in today's lesson, we're going to talk about contraception and we're going to talk about STIs. Now, contraception, if we look at the word like conception, conception is another word for fertilization. I think I've used it before in previous lessons. So contra is against. So contraception is the use of medicines, devices, or surgery to prevent pregnancy. Okay, that's what contraception does. Now, the only method of contraception that works 100% of the time is abstinence. What is abstinence? It is refraining from sex. That is the only 100% way to effectively prevent a pregnancy. Okay? If you don't have sex, you can't get pregnant. Now, there are methods to try and limit the chances. Okay, no contraception method is 100% other than abstinence. But there are methods that can be used that will limit the chances of pregnancy. Now, there are two broad categories of contraception. There are barrier methods, and as we'll see, there are hormonal methods. So what is a barrier method? Barrier methods work by trapping and blocking sperm. Okay, so things like the female and male condom, the cervical sponge, diaphragm, and a cervical cap. All of these methods are barriers. So basically they work by blocking sperm from either entering the vagina at all. So the male condoms in practice, they're supposed to just trap and kill sperm within the condom. Female condom works by inserting it into the vagina, and the male would ejaculate into that female condom. Okay, a cervical cap sits up against the cervix to block the path of sperm from getting into the uterus and into the fallopian tubes. And the diaphragm and the cervical sponge works the same way. Traps the sperm, and usually there is some kind of spermicide, so some kind of chemical that actually would kill the sperm as well. Added benefit to using barrier methods is that condoms, they limit contact. And this can have the added benefit of helping to lessen the chances of getting a sexually transmitted infection as well. Now, the second type of birth control is hormonal method of birth control. So the birth control pill or oral contraception, a vaginal ring, a Depo-Provera injection, contraceptive skin patches, implants, IUDs. All of these are considered hormonal methods because they rely on estrogen and progesterone. And remember from last lesson, estrogen and progesterone have strong negative feedback effects on FSH, right? So if you have high levels of estrogen and progesterone, that's going to block FSH. If you don't have FSH being produced by the pituitary, then you don't have a follicle being stimulated. If you don't have a follicle being stimulated, then in theory, you don't have an ovum being released, right? So that's how all chemical contraception works. Now, how that chemical contraception is delivered, how those hormones are delivered is different. So if you take the pill, an oral contraception, you're obviously taking that, orally. It's a pill, and you take that every day. Okay. If it's a vaginal ring, this ring is inserted into the vagina, and it slowly releases these hormones throughout the month. Okay, and this can be kept in there for longer periods of time. The benefit here is you don't have to remember to take a pill every day. Okay, Depo-Provera, that's an injection of very slow release estrogen and progesterone, and you usually get this about once every 3 months. Okay, and again, you don't have to worry about taking a pill every day. These compounds are released and they break down very slowly and they're released into the bloodstream very slowly. Okay, same with contraceptive skin patches. Again, these are just like kind of look like a Band-Aid, right? They go on topically, so you put it on your skin and this just releases those hormones into the bloodstream through the skin. Now, implants, These are implanted under the skin, okay, usually on the inner arm. And again, they would have these chemicals in them, and these chemicals would be released very slowly. Now, an IUD stands for intrauterine device. And this is what an IUD looks like right here. Okay, this anchor-looking device. And sometimes they're made of copper, or they have copper wire kind of wrapped around them. And what the copper does is the copper will dissolve in the liquid of the uterus. Okay, and same with the actual the device. Okay, it would sit in the uterus. That's why it's called intrauterine device. It sits in the uterus. It has to be put there by a doctor. Okay, and it sits there and basically disrupts the environment of the uterus to try and prevent implantation. So they do not prevent fertilization. Okay, the sperm would still be able to make it up to the ovum. Some of them have progesterone and estrogen, so they do slowly release that to prevent ovulation. But that doesn't always occur, so fertilization can occur, but they're there mostly to disrupt the environment so that the embryo doesn't implant. Okay? But regardless of the delivery method, okay, whether it's an IUD, a vaginal ring, the pill, an implant, a shot, regardless of how you're getting it, all of these hormonal methods kind of work in the same way. And that is to have a negative feedback effect on FSH. So by blocking FSH, a follicle would not mature, and if a follicle doesn't mature, an ovum would not be ovulated. Okay? Now, progesterone has the greatest negative feedback effect on FSH. Some of these birth control methods have a combination of progesterone and estrogen. Now, estrogen does have a bit of a negative feedback effect, but estrogen will also increase the production of mucus, okay, which blocks the opening of the cervix, and that may trap and prevent sperm from getting up into the uterus and fallopian tubes. Now, in big red letters here, you guys, I have hormonal methods have no protection against sexually transmitted infections. All right, so although they're pretty good at preventing pregnancy, there is no protection against STIs. So I actually took this picture. I was sitting in a doctor's office waiting for the doctor, and the doctor had this up on the wall. So I snapped a quick picture, and this is a really great graphic showing kind of some of the effectiveness of various birth control methods. So if we take a look down at the bottom, that's kind of our control, okay? No method at all. Zero method. For every 1,000 women that are using this, okay, actually nothing at this point, okay, not using any method at all, in a year of practicing this, of 1,000 women, 850 would get pregnant, okay, in a year of using nothing. No oral contraception, no hormonal contraception, no barrier methods. It's about an 85% chance that you'll get pregnant if you don't use any method at all. Okay. Now, natural birth control methods, you see a little calendar here. This is what I was talking about, the rhythm method. So this is where a woman would keep track of her menstrual cycle, and when she thinks she's ovulating, around that time of ovulation, she would not have sex during that time. Okay, so sometimes this is called the rhythm method. So you're looking at the calendar and saying, okay, during this window we are not having sex. The efficacy of that, again, it's better than no method at all, but still, 1,000 women practicing this for a year, about 240 of them would get pregnant. Okay, so still about a 25% failure rate. All right, the withdrawal method, we talked about this in a previous lecture. This is where the man would withdraw his penis before ejaculation. Okay, but remember, there might be residual sperm left over in some of these little nooks and crannies in that tubing, right? Especially in that Cowper's gland. The Cowper's gland would secrete its secretions before ejaculation would happen. So again, 1,000 women over the course of a year, if they were practicing just the withdrawal method, it has about a 22% failure rate. Interestingly enough, the male and female condom, typical use, right? We have typical use and we have perfect use. So perfect use, we're only about 20 to 50 pregnancies per 1,000 women over the course of a year. But obviously perfect and typical are very different. Okay, condoms have an expiry date. Some people don't know this. They have this condom sitting in their wallet or in the glove compartment of their car, for years sometimes, just waiting. And then when they finally use it, it's expired and they break down. Okay, these things break down. So if there's a break in that barrier, then sperm can get through that break, right? So if there's a crack, if there's a pinhole, just a little bit of a leak in the condom, then they don't work. Right? Sperm are very small. They can get through you might not be able to see the crack or hole in the condom, but sperm don't need much room to get through. Okay? So you can see typical use, about a failure rate of around 20%, right? Now the vaginal ring, contraceptive patch, oral contraception, injectable contraception, so all of these would be hormonal. But they have, around a 6 to 9% failure rate. Now, intrauterine devices have the highest efficacy. Okay, again, these are implanted by medical professionals. Some of them have hormones in the actual IUD. Okay, so a plastic IUD might be implanted and it might have progesterone and estrogen implanted into that plastic. As I mentioned before, some IUDs have copper wound around them. And you can see that the difference between perfect use and typical use are pretty similar because these have to be implanted and you cannot take them out. You don't forget to put them in, nothing like that. Once they're in, they're in. And when you do want to have children, you have to have them taken out by a professional. Again, I just want to stress, even though it's pretty good, it's not 100%. Okay? The only way to make sure you don't get pregnant is abstinence. Now, sexual intercourse involves close physical contact and the exchange of bodily fluids. Now, remember from previous study, pathogens need a couple of different conditions, right? They need warmth, they need moisture, and they need a food source. So the pathogens that cause sexually transmitted infections, this is a great way for them to be traded back and forth. We have close physical contact. We have the exchange of fluids. So these infections are easily transferred from one person to the next. Now, infections transferred only or mainly during sex are called sexually transmitted infections. Sometimes in older literature, you might see this referred to as STDs. They've changed the language a little bit recently. We call them now STIs. Okay, and they're usually caused by either viruses, bacteria, or parasites. In Canada, some of the highest rates and increases in sexually transmitted infections and diseases are among young people between the ages of 15 and 24 years of age. Many of these STIs are on the rise in Canada right now among young people. They're skyrocketing. We actually see ad campaigns by the government where they're warning people. And now one of the biggest reasons that these are on the rise is because many of these infections can be passed on when they're asymptomatic, meaning that somebody might not even know they have an STI, okay, and they're having sex and they're passing that STI to other people without even knowing it. Okay, they don't even know they have the infection. So asymptomatic means that you might not have any idea that you have this and you're having unprotected sex and you're spreading these infections. So if you are having sex or you're thinking about having sex, you need to know how to lessen your chances of contracting one of these STIs. So there's kind of three categories of STIs: viruses, bacteria, and parasites. So STIs that are caused by viruses, they can be managed, but there is no cure. Okay, let that sink in for a second. Once you get one of these viral STIs, let's say you pick one of these up at 15, 16, 17 years of age, you have it for the rest of your life. Okay, not till you're 30. I mean, you might think, oh, 30, 40, 50-year-olds, that's the end of the life, right? Well, no. Life means to the end of your life. So in Canada, the average lifespan of a person in Canada is around 78 years old. So if you pick one of these up at 16, you're going to have this for 60 years. Okay, there is no cure. So things like HIV and AIDS, hepatitis B and C, genital herpes, HPV virus. Okay, HPV can cause cervical cancer. It can cause other types of cancer. Genital warts. Okay, these are all viral. Once you got them, you have them for life. So these viruses can be passed through sexual contact. They can be passed through the sharing of needles. So some of these are transmitted via intravenous drug users who are sharing needles. And that includes steroids as well, ladies and gentlemen. I know that this is a concern, especially with teenage boys. We see with the rise of social media and body dysmorphia is increasing more and more with males, especially in that age group of 15 to 24. They think, I need to look a certain way, and they're starting to take steroids, and this is commonly taken intravenously with needles. Okay, so using dirty needles can pass these. Many of these viruses as well. Now, some of these viruses can also be passed from mother to child. So if mom has genital herpes and she has an outbreak of herpes and she gives birth to a child, that child can pick up herpes just by being born, okay, which is pretty unfair to a baby, right? Same with AIDS. That can be passed as well. Now, STIs that are caused by bacteria, these are some of the most common STIs that we see. The benefit to these, I should choose my words differently. There's no benefit to getting an STI. But the difference between a bacterial STI and a viral STI is bacterial STIs can be treated, if caught early enough, with antibiotics. Now, one of the problems with these STIs caused by bacteria is, again, they are asymptomatic a lot of the time. So you might not even know you have them, and you might pass them on to other partners without even knowing that you have them. When they do present, they generally kind of present very similar, especially chlamydia and gonorrhea. So some of the symptoms of a chlamydia or gonorrhea infection might include fever, pain while urinating, and a pus-like discharge. Okay, by the time you are symptomatic, you may have already had this for a long period of time. Many people don't want to go to their doctor to get this treated. They might feel embarrassed to have this treated. Now the problem is untreated bacterial infections can actually progress up the urinary tract in males and up the reproductive tract in females. So if untreated, chlamydia and gonorrhea can actually get into the fallopian tubes, into the cervix. So these need to be caught early and they need to be treated early. Now, chlamydia and gonorrhea, very common in young people. Chlamydia is the most common STI in Canada. Okay. Now, syphilis is a little bit different. It is a bacterial infection, but it can be deadly if left untreated. There are 4 distinct stages to it. Everything from a weird rash on the palms of your hand and the bottoms of your feet to these open sores And eventually, if this is left untreated, it can get into your brain and it can cause all sorts of damage to your brain and your other organs, and eventually can be deadly. Now, these bacterial infections, if they are undetected for long periods of time, and I mentioned that many of them are asymptomatic, you might not even know you have them, or they're left untreated because people don't have access to a doctor, or maybe they're too embarrassed to go to their doctor, these infections can travel up the reproductive tract, and they can cause something known as PID. PID stands for pelvic inflammatory disease. Okay, so pelvic inflammatory disease is an infection of the upper female reproductive tract. So we're talking cervix, uterus, fallopian tubes, ovaries. Now, if these structures get infected, scar tissue and inflammation can damage these structures. Okay, and the scar tissue can build up on these reproductive structures and maybe eventually lead to infertility. Assisted reproductive technologies. Now, assisted reproductive technologies refer to various medical techniques that are used to assist individuals and couples in conceiving a child. Now, it's estimated that between 15 and 20% of couples will have trouble conceiving in their lifetime. Sometimes it's taken for granted. Young people think, oh yeah, I have this life plan. I'm gonna get my career. I'm gonna get married. I'm gonna have children, and life will just go on, or whatever order you want to do these things in. But like the statistics say, somewhere in the neighborhood of 15 to 20% of couples might not be able to conceive, or might have trouble, and it could take years to actually conceive. So we have technology now, we have medical technology that can help with this situation. It's thought that somewhere in the neighborhood of 5 to 10% of couples will seek some sort of intervention, some sort of reproductive technology to try and help conceive. So there's a number of different types of technologies that you may have heard of before. In vitro fertilization, often abbreviated as IVF, this is a procedure where eggs are harvested from a woman's ovaries. Okay, so using a needle, doctors would go in and take out follicles from the ovaries. Generally what would happen is women would have to undergo hormonal treatments. So they would get large doses of FSH to try and get multiple follicles to mature in one reproductive cycle. So instead of just one follicle maturing, number of them they would be taken out of the ovaries, okay, and they would be fertilized outside of the female reproductive tract. In vitro in Latin means in glass. Okay, so this was traditionally done in a glass petri dish, okay, in a laboratory. So sperm would be collected from the male, ovum would be collected from the female, and the actual fertilization would be done outside of the female body. Okay, the embryos, the fertilized ovum, they would become embryos, and then they would be implanted into the uterus. So in Canada, this is not covered by healthcare. So if you were one of these individuals who had to seek treatment in order to get pregnant, the average treatment of IVF in Canada, as per recording this lesson in 2025, is between $10,000 and $15,000 per cycle. Now, this doesn't always happen after the first cycle. Some couples, some women have to undergo multiple cycles in order to actually have a pregnancy occur and a baby be born. So this can cost, tens of thousands of dollars to happen. So there aren't fertility clinics in every single city. Some women have to travel as well to get these treatments done. So there's hotel costs, there's travel costs. Okay, so this can really add up. Another type of reproductive technology is called artificial insemination. And in artificial insemination, a sperm is directly injected into the woman's uterus or cervix. Now, this is often used for infertility kind of due to the male. Sometimes males don't produce enough sperm, or the sperm that they do produce are not very strong and can't actually make it up to the ovum that's been ovulated. So in this case, sperm would be collected from the male, and medical professionals would try and collect enough viable sperm to inject into the uterus. Now, there's a number of other types of reproductive technologies. I've just chosen a few here that are a little more common and that you might encounter in a context box or maybe in your life. Egg and sperm freezing. This is used for individuals who wish to delay childbearing or preserve fertility before undergoing medical treatments. So some women will have their ovum frozen before they undergo chemotherapy. Remember, females are born with all the ovum they're ever going to have. So if a female has to undergo radiation therapy or chemotherapy for cancer, that radiation or chemotherapy would affect the ovum that are in her ovaries. So women would choose to have the ovum taken out, frozen, they'd undergo their treatments, and then later on they would use other reproductive technologies to fertilize those ovum and then implant them into the uterus later. Now, this is becoming more and more common for couples who do choose to do reproductive technologies, and this is what's known as pre-implantation genetic testing. Now, what this involves is genetic testing performed on embryos before implantation. So I mentioned before that during IVF treatments, there are multiple embryos that are formed, and then some of those embryos are chosen and then implanted. Okay, the rest can be frozen for later. So what is happening now with our genetic technologies is that couples are having their embryos pre-screened for certain genetic diseases. So if an embryo has a particular genetic disease like cystic fibrosis or Tay-Sachs or something like that, they would choose not to implant that particular embryo. But who chooses the characteristics that we're going to screen these embryos on, right? There are countries in the world where this screening can be used to differentiate between male and female embryos, right? And there are certain countries where they would prefer to have male offspring. So instead of implanting female embryos, they'll only implant male embryos, right? So where is that line? Where do we differentiate what embryos we implant and what embryos we don't, and who's that up to? So there are definitely ethical considerations, right? And that whole designer babies issue. Okay, also access and cost. This is extremely expensive. If you're somebody who has a lot of money, you have access to this. But what about people who don't have a lot of money? Is it fair that they don't have access to this and don't have the same ability to have children that a rich person would? Okay, so there are a lot of social and ethical considerations to be taken into consideration when talking about this stuff. All right, that's it for today. There's some homework in your note package.